Hello, GARM family. My name is Doug Tucker. I'm an interventional spine and regenerative medicine physician looking to talk to you about some of the exciting treatment options and comprehensive care offerings and counseling that we can provide to you from Global Alliance of Regenerative Medicine down in Roatan, Honduras. Dr. Terry, as one of the most prominent orthopedic surgeons in the United States for decades, comes with a wealth of experience about traditional surgical options, as well as delivering cutting-edge therapies, including regenerative medicine and high-quality stem cell procedures that he's been doing for more than 10 years. I've been excited to join the team. I do interventional spine care. I treat 7,000 to 8,000 patients a year through traditional interventional spine therapies that are allowed in the United States. We also have partnered to develop treatment algorithms and regenerative medicine procedures that are not allowed within the United States, but show safety and promise for healing. A lot of these therapies involve stem cells. They don't have to. We inject tears within the disc with fibrin through a process we're referring to as DiscShield, which is a combination of the fibrin injection with appropriate stem cell therapies for degenerative joint care. A lot of exciting treatments where we can really get to the core problem, whether it be the disc, whether it be degenerative joint pain, whether it be a combination of the two, whether it be muscular pain that would benefit from an additional PRP injection. There's a lot of different things that we're able to do and we're excited to provide, but we're not tilting entirely to that side of care. What we pride ourselves in is a full evaluation of patients. If there's a relatively basic condition that would likely respond well to traditional care, we look to point you to that care in the United States somewhere close to you. But there are patients who have tried traditional medical care who are possibly candidates for surgery that they would rather avoid, or a surgery that's a low probability of success. Those patients would likely benefit from at least considering regenerative medicine offerings. If you are interested in learning about what we have to offer, or just interested in what does gene therapy play? What does a stem cell even do? What can I anticipate from a premature cell line therapy? And how does this compare to the care that is legal and allowed to be provided in the United States? There are regenerative medicine providers in the United States. What's the difference in the therapies that we're allowed to offer to you in the United States, which we can, versus those therapies that are safe and legal in Roatan, but yet not yet allowed in the United States? These therapies are coming to the United States. They're just not yet here. The FDA is continuing to open doors and consider therapies, but at the same time, they're closing doors to therapies that were previously available, including peptides. But just what we want to be able to provide for any patient that we're consulting with is a comprehensive scope of care consultation. If you would benefit from a surgery around the corner, we want to suggest that to you. If you just need a simple injection-based treatment that can be offered in the United States, we're going to recommend that to you. But we also have knowledge, but not just the knowledge. We have the ability to offer it. I can counsel you in my United States practice on therapeutic options that I'm not allowed to legally administer. And that hurdle is not before us in Roatan. We have safety protocols that are of international quality and standard. Any investigational therapy is going through an IRB that matches the standards of anything in the United States or around the world. There's a lot of exciting people and projects coming down to Roatan, given the treatment flexibility, cutting edge therapies and trials going on constantly. And if there are therapies that you believe you want to learn more about, whether we can offer them to you or not, we would like to have that discussion with you. And if you ultimately would benefit from care close to home, we're going to point you to it. If you want to come down to Roatan because you would benefit from the service offerings that we have available, we're clearly open to that and we'll be happy to see you down there. Please reach out. Our contact information will be available through this post. Let us know how we can help you. If you're looking to be involved with us as a patient or just need a consult, we are eager to talk to you. Thanks.